Hello, I'm Dr. Manas Manohar, consultant pain physician practicing at Poona Hospital since last 7 years. So today I am going to talk about back pain. So we at Pain Clinic in Poona Hospital see a lot of patients with chronic pain. About 70% of the patients that come to us are suffering from low back pain. So why is low back pain such a common thing? So firstly, it is because of the lifestyle that we are following these days, lack of exercise, incorrect posture, long sitting hours, wrong food habits, smoking, alcohol. These are multiple factors which has led to an increase in the prevalence of low back pain in our patients. Along with that, certain age-related degenerations in the spine, age-related weakening of the muscles is what also contributes to low back pain. So our approach to a patient with low back pain is pretty unique. So when the patients come to us, we first observe the patient as to how he is walking into the clinic. So as soon as you step into our clinic, or just as soon as you're coming into the clinic, our examination starts. Then we focus on the history as to what is the aggravating factor, what is the relieving factor, any particular position you are comfortable in, any particular activity that increases your pain. Since many patients have pain of chronic duration, that is a long duration, so it is very important to ask the patient about the origin of pain as to how it started. So it needs a bit of communication with the patient so that he can tell how did the pain start, because that is very important for us from the point of view of finding out the pain generator. Lower back is a very big structure which has a lot of muscles, lot of joints. There are intervertebral discs, there are nerves. So there are many things which can cause low back pain. It's not like low back pain is like because of sciatica, or it's because of osteoporosis, or it is because of degeneration. You cannot pinpoint one factor just by simple history. So examination is done after eliciting a thorough history. If the need be, we ask for certain investigations like X-ray or MRI in certain cases. After examining the reports and with the history and clinical examination findings, we come to a probable diagnosis. So for the low back pain, there are certain pain generators, which are the facet joints in the back, sacroiliac joint, the herniated disc, or impinged nerve. These are the four common things which can cause low back pain in patients. So according to the history, according to the examination and MRI, we come to a probable diagnosis, and then treatment is advised. So our first line of treatment is simple medications and certain lifestyle modifications, certain posture related modifications, and a good healthy diet. If that does not work, the next step is simple PD based interventions like trigger point injections, dry needling for tight muscles. So these are the simple procedures which can be carried out in the OPD. If that also does not help, then we might need to do specific procedures like selective nerve root blocks for the selected impinged nerve, facet joint injections for the inflamed facet joints, medial branch blocks for the denervation of the facet joint pain, and advanced procedures like radiofrequency ablation or radiofrequency neuromodulation for the nerves of the back or the nerves of the leg. So depending on your symptoms, depending on the duration, a treatment plan is sought for the patient, and after convincing the patient, after taking his consent, we proceed with the treatment. The most important part begins after the treatment, that is, after whatever procedure we do, we aim for a good pain relief. Once we get a good pain relief, we generally put all our patients on a rehabilitation program wherein we advise certain posture related precautions to be followed and certain core and back muscle strengthening exercises which they need to follow and need to continue on a regular basis. So it is very important to maintain these things to get good and a long lasting relief. So this is how our approach is towards a patient of low back pain, which is kind of a holistic approach, wherein we not only want to have pain relief, but also want to improve the lifestyle of the patient and also get the patient back on his toes and get back working. So if you have any questions regarding the same, you can just mention in the comments. I will be happy to answer them. Thank you.